Thank you. Hello, everyone, to session 13 of the medical debate. And today we'll be talking about organ transplantation, which I think personally is a really cool topic because there's lots of ethics concerning it. And it's a bit different to what we normally do here at the medical debate, where we talk about a certain field of ethics and then build upon it. But we thought that it would be really cool to have more of an application session where we discuss a topic which is really, really topical and very interesting and apply ethics throughout rather than just have an ethical theory. So, Shivas?
Right, so we're going to start off a little differently to usual with a quiz, which we don't usually do, but I think you can access it from the polls. So the first question we're going to ask is, which organ is most frequently transplanted in the UK?
So the way the poll works actually is that we're going to launch all the questions and we're going to see what answers you guys have, and then we're going to give you the actual answers. So we're just going to launch the poll now. It should be live, and please answer. We just want to see what you
guys. So you just have to click on the polls button. Hopefully you can all see it.
I don't think you even have to click on the polls button. It should just appear in front of you.
Okay.
If you guys start answering the polls.
There are 4 questions there, so please just select which one you think.
Oh, cool. People answering.
Mm-hmm.
Just gut reaction. We're happy with that.
Yeah, so this is just to see how much you kind of know already, just so you have a bit of a background knowledge of this topic, because it is quite an interesting topic and quite a big topic, which would definitely be asked about. Okay, so we've got just over half of you have voted.
Yeah, we'll give it 10 more seconds and then I'll retract the poll. Right, so guys, put your answers into the poll.
Yeah, please don't put it into the chat. There should be a poll button.
The poll wouldn't turn up just in case. Oh, you're able to let multiple answers. Sorry about that. But basically, it will only appear for people that have just joined. Okay, so I'm going to end the poll now, guys. Thank you very much for answering. So the results are as follows. Share results. If you guys can see the results there. But you can see the results, and you guys said that kidney, where you guys think that kidneys are most commonly transplanted. You believe that the first transplant was performed in 1964. Most of you think that 1,600 organs were donated last year, and actually the amount of people that think it's opt-in or opt-out is neck and neck. It's 50% each. So Shivas?
Right, so if we go over the answers, so an organ which is most frequently transplanted in the UK is, of course, the kidney, which I think most of you put, so well done. A couple of you put heart and a couple put lungs, but as you can see here, both are actually transplanted as well. So is the pancreas. These are all able to be transplanted, but the kidney is the most commonly done one. And so for question 2, we were all a bit more split, although the most common answer was 1964. I'm afraid you will be right if you put 1954, so a little earlier actually, which 29% of you put. So yeah, and that was of course the kidney as well. Yeah, so Siddhant, do you want to perhaps go over the next 2? I think you're muted.
So the next question was how many organs were donated last year? And so most of you put 1,600, and you would be correct. It is 1,600. You guys were right, so well done. And the last question was, does the UK have an opt-in system or an opt-out system? And it was 50%, but the 50% that said opt-out were correct. The UK, just recently, it changed to an opt-out system.
Yeah, so well done if you got those right. It doesn't really matter. You'd never be, asked these questions specifically in an interview, but it's just nice to have a bit of a background knowledge about them. So yes, and we'll be talking about these, throughout this session, especially the opt-in and opt-out. We'll be discussing that near the end. So the first thing we're going to look at today is a little sort of case study. I'm just going to read it out to you, so and then we'll discuss it. So it's about who actually deserves organ transplants. So one of your patients, Ron, aged 29, has recently died following a heart attack. He confirmed that he wanted to donate his heart after his death. 3 people are eligible for transplant. All 3 would have to take immunosuppressants if they received the transplant. So Neville, aged 76, is unmarried and has no children. He has coronary heart disease, which you believe was caused as a result of his unhealthy diet, lack of exercise, and addiction to nicotine. Neville still pursues this lifestyle and is not keen to give up smoking. He also uses a wheelchair and rarely walks. And Ginny, aged 23, is a junior doctor. She's been married to her wife Luna for 3 years and is a mother of 3 children. She is Ron's youngest sister, and as a result, you believe her immune system is least likely to reject the heart. And of course, this is due to like the tissues being closer matches. I'm sure you already know a bit about that. So our last patient, Cho, is aged 9 and has a 6-year-old brother called Fred. She has a rare terminal immune disorder, which makes her extremely susceptible to infection. And without a transplant, you estimate that she only has another 5 years of life left. She's a child, and you worry about whether Ron's heart will be too large for her. Sorry, I've spelled too wrong there, but yeah. So someone's asked, what is Ginny's medical condition? I don't know exactly. I don't think it really matters. Just that she has. It's just I don't think Ginny has one. It's just that she's Ron's sister, so her heart is more is less likely to reject the heart.
I'd
So
say,
we're gonna.
sorry, the other thing I'd say is just to take that case study in, would be that imagine that Ginny, whatever problem she has, can only be solved by a transplant.
Yeah. So I think what we need, I think if you're asking, I think all these 3 patients are basically in need of a transplant. They're on the list. So we're going to discuss now who you think deserves a transplant and whether your answer, of course, follows the 4 pillars of medical ethics. So if you like, just take a minute to read this case study and just type in your answers in the chat, or feel free to unmute yourself. We'll give you a minute or 2 to do that, and then we'll just discuss it and go through who you think deserves this heart and who you think doesn't, and perhaps why you think that. So we'll give you a minute or 2 to do that. Just read through these, and just have a think about that.
Feel free to put things in the chat, guys, if you want.
Just say a name if you want. Okay, so we've got quite a few people. I think everyone so far has said Ginny. And a couple of you have said that's because it has the highest chance of being successful, which is very true. But I'm interested to see if that's the only reason you think that she deserves it. Of course, you could argue that, many of you might think Cho as well, considering that she's just a child, much younger, and has her whole, life ahead of her. Whereas if she didn't receive the transplant, she might, not live. She only has another 5 years of life left. So I'm interested to see. Right, so some other people have said, so Ginny, most chance of being successful, good size and genetic links. So many of you are taking this from the point of view of like success, what has the most likelihood of success. So I assume that means you think that for all cases, patients should be chosen based on how successful the operation would be, which is interesting. But there are many points you have to consider here, of course. Right, someone said, since they're adults, we should ask Ginny and Neville if they would even like the transplants, or whether they'd rather give it up to someone else like Cho as well. That's very interesting. And I'm not too sure. I don't believe in a real scenario whether if this situation were to occur in real life, whether the 3 patients would actually get to look at other patients who are eligible for the transplant and perhaps decide whether they prefer to give it to someone else. So someone said the heart may be too big for her. I assume you're talking about Cho. Yes, so that's true, and that may mean that it's more difficult to it's less likely for the operation to work. Someone's put Cho probably can wait a little longer and get the heart of a child. That's true, but you've got to remember, we saw at the beginning from the quiz that there aren't, although there are, there aren't many people who actually give their organs. There are many, but there aren't enough to deal, for the amount of people who actually require them. So it's more than possible that Cho won't actually, receive another heart. There might not be one available for her. Right, so someone said she is a doctor as well and has the potential to save other people's lives. So I assume you're talking about Ginny here. Yes, that's true. Although, what if Cho becomes, what if she grows up and becomes a doctor as well? It's tricky here. Donating the organ to Cho could actually be considered as being against non-maleficence. Yes, so I'm not too sure what you mean here. I think you mean against non-maleficence. So, well, okay, I'm not too sure what you mean there.
I mean, feel free to unmute yourself and explain what you mean or put it in the chat.
Mm-hmm. Yeah, someone said, I think in this instance, we have to consider the viability of the transplant working, the chance of success. Right, so that's what many of you are getting at, I think. You're talking about the success rate of this, and that's how you're basing your decision. But I've noticed not many of you are actually talking about, the people and their lives. Ginny, of course, has a wife and is a mother and a family. So perhaps that should be something you should consider. Obviously, if you gave it to her as opposed to Neville, perhaps, who has no children and no spouse, then it might have a lower, impact on those people. It would have less of a emotional effect on them if that patient were to die. And of course, Cho has a family as well. And she has her whole life ahead of her. Right, so someone said, since there is a risk of the heart being too big for her, which could end up causing more harm, justice. Ginny is a junior doctor. She's the opportunity to impact on more people's lives. Right, so yeah, so you've come up with some really good points here, although I think most people have said Ginny, and I think that's mainly due to her job and the fact that it's most likely to succeed with her. Yes, someone said something very interesting. Good point, but we're getting into a slippery slope of saying people's occupations affect their worth. Yeah, that's very true. So, by saying Ginny, you should give it to her because she's a junior doctor, that's saying perhaps that her life has more worth than someone who isn't a junior doctor or someone who, is unemployed, perhaps. And is that really how we should be going about making our decision? It's quite tricky here. So yeah, you've all come up with some really good points. I wonder if anyone wants to unmute themselves and share their opinion out loud. Please feel free to
I
do
also
that.
wanted to say that considering people's jobs may have more of an effect on if they deserve a transplant or not is directly against the pillar of justice, where you're supposed to treat everyone equally.
Right, yeah.
So, do you mind if I just chime in? Because my keyboard cut out. I'm just going to ask, like, as doctors, can you take into account like patients' indication, say for in this example, not to change, like not to have a healthier lifestyle and therefore potentially to abuse that organ more? Are you allowed to make a decision sort of based on what they've told you?
Well, we aren't doctors ourselves, but I assume being a doctor, you would have to, I think that would be something you'd have to take into account, but you shouldn't base your decision on it. Like, for example, if you know someone, so I assume you're talking about Neville in this situation, who is, has an unhealthy diet, lack of exercise. So giving him that heart, he might, not use it to his full, capabilities. He might sort of abuse or misuse it, and it might be wasted, you could argue, on him because he's not treating it right and because he's not keen to give up smoking. And I think you might want to take that into consideration, but I don't think you should discriminate based on it. And I think it's up to patients how they, as a doctor, it's a doctor's duty to care for patients and provide them with the best possible care and treatment. Whereas it's not your duty to judge people and their lifestyles. So as a doctor, you would just you would provide them with this heart and help and treat them the best you could, but you shouldn't dictate how they should then, use that heart because it's their heart and it's their life. So yeah, I hope that answers your question. Someone has said, could choosing Ginny due to her job family be considered bias in terms of justice? Yeah, we've mentioned that already. I think it would be, and I don't think it's actually legal or correct according to the medical code. So when you say full capabilities, what do you mean? So in terms of Neville, I think you're talking about Neville here, because he has such an unhealthy diet and lifestyle. Perhaps giving him this heart would mean that he's not, because obviously this would damage his heart, and therefore you could say he doesn't deserve it because he's not going to treat this heart correctly. Right, someone said Neville is elderly, which means he might already have underlying health conditions, which makes him most in need of a heart. That's an interesting perspective. Without relatives and children, he is required to be living independently, which combined with his age might be the best recipient for the heart. His addiction to smoking could affect other organs, which would make him a less likely candidate compared to Ginny or Cho, who have no profound misuse of drugs or chemicals. His age could also go against him, as this shows he has a lower chance to survive longer years compared to other candidates. Right, so you've said, kind of both sides for Neville here. Yeah, we don't know for sure whether he's in most need of this heart. You could argue that, you could argue for any of them that they're in most need of the heart. But I think that, yeah, you're right. You could say, because of his other organs, he's a less likely candidate compared to Ginny or Cho, who don't have these problems, who don't have these addictions, and therefore wouldn't misuse the heart they receive. So, right. So, yeah, I think we've had a very good discussion here. I don't know if anyone else wants to unmute themselves and share their opinion, but if not, we can move on. Right, I think that's it then. I think we'll leave that there. But generally, I think the consensus was that Ginny deserves it due to the success rate of the operation when giving it to her. But yeah, there are many things to consider here, including people's ages, their families, and I think for Cho as well, even though she is 9. Because she's so susceptible to infection, and obviously she would need to be given immunosuppressant drugs if she were to receive this heart. So that might be, not beneficial to her. She could she could get another infection from another disease, and that could obviously affect her very badly. So yeah. So I think we'll move on now. Sidan, I think if you want to take over.
So, what is death is actually quite an important question, because there's a specific standard for announcing someone dead, pronouncing someone dead. You hear all the time, you hear horror stories about people coming back from the dead, or medical professionals messing up the fact that someone might not actually be dead, and then that person coming back alive, or being able to feel the pain through surgery, or various different things. And so there are actually 3 different types of announcing death. So again, there's no universal definition of death. It varies from different places to places. However, it is important that organs are only taken from a patient after they have been confirmed by a doctor to be dead, because they need the organs to survive. And in different countries, organs can be harvested after the following incidences. So brain death, for example, this is in the UK, is where death is pronounced after they've certified that every part of the brain, all the parts of the brain, are not working, and therefore you are classified as dead. And apparently this is the easiest to diagnose, and due to complete shutdown of the brain, the patient is no longer able to control blood flow to their organs or experience any sensory sensations, such as pain. Once the patient has been deemed unresponsive and unable to perform reflex actions, they are declared dead, which is, as you guys might have learned in your learning about biology or brain studies, you will know that the brain and the reflex arc is what causes pain and things to be felt. Nociceptors, pain receptors, etc. Higher brain death is another type of it's another type of definition of death, where the irreversible loss of function of the neocortex, or the part of the cerebral cortex responsible for consciousness, memory, personality, and perception. So in a sci-fi show, you might hear higher brain function, and that's what this is referring to. And so this is, under this definition, a person can be declared dead even if other parts of the brain are still functioning. So this definition defines patients in a vegetative state as dead. And obviously this raises ethical concerns, because technically they could be alive because parts of their brain are working, but they're not responsive, they're not conscious possibly, they've lost memory possibly, etc., etc. And so again, this raises issues as a accepted variable of defining death. And the last one we're talking about is non-heart beating death. Or this is when you can't reverse it says irreversible cessation of cardiopulmonary function, basically when the heart stops beating. And I believe they use this in the US, Shivas, is that right?
I think in the US it's higher brain death is the
Higher
definition.
brain death. Okay, right.
Yeah.
So I'm not exactly sure when non-heart beating death is, but basically if a patient's heart stops beating, but their brain is still showing signs of activity, then in this scenario, they're said to be dead. However, and again, it says after a waiting period, a check is required to make sure cardiopulmonary function does not spontaneously return. It is possible for a patient to experience pain and perform reflexes because, again, their brain may be working, but their heart stopped. And again, this raises ethical concerns, because what if you could revive the heart, like defibrillators, etc.? And, you know, this is quite a topical debate. So a few questions are: higher brain death seems to be more of a complete paralysis of a dementia patient. So that's quite an interesting view, actually, because, I mean, do you want to expand on that? Do you have anything more else to say? How many times would you try to revive a patient with CPR? That's a very good question. So CPR, I'm not entirely sure, but I believe CPR is when people... CPR. See, again, like Shiva said, we're not medical professionals, so we can't say for sure, but, you know, you should research that. And I don't think CPR is used for continuous... Again, basically, if they, in the UK, they use brain death. So if they're classified to be brain dead using these requirements, then I doubt they would try and revive that person.
Yeah, just to add on to that about CPR, I think the reality of it is quite different to what you see. You know, on TV, you might see a patient whose heart stopped and they'd be, you know, attempting CPR numerous times and you know, attempting resuscitation. But in reality, that's not really the case. It's when a patient's heart stops and their brain activity then stops, you know, the patient is confirmed as dead. And it's very rare for patients whose hearts have stopped to actually, you know, be able to get that rhythm back. So I think it's, you know, it depends really for all different cases. But I think in general, once the heart is stopped, that's what the traditional definition of death has been. When the heart stops beating, that's when a patient is declared dead. But now, obviously, we know that it is possible, although rare, for patients' hearts to come back into, you know, a beating rhythm, and therefore being able to restore function to their brain and organs. But yeah, I think it depends really on the patient. Siddharth, I think you're unmuted again.
Yeah, no, I know. Sorry, I was just reading a question. What about long comas? Is there still signs of brain activity then? So again, I think in a coma, I do believe that you do have some sort of brain activity, because otherwise you would be classified as dead. But then, as higher brain death suggests, that this definition defines patients in a vegetative state as dead. And I'm not sure if a coma comes under a vegetative state, but if higher brain death were the mark to, you know, to see if someone was classified dead in the medical field, if vegetative state does indeed count coma, then perhaps they would be counted as dead. I'm just going to double check that, Shivas, if you carry on.
Yeah, so I think comas are classified as being in a vegetative state, but in different countries it would differ whether they're classified as dead or not. And yes, someone said vegetative state sounds very disrespectful to the person. Does that come from someone being called a vegetable? No, I don't think it's due to that. And that is an actual medical term, but it just means that, you know, like a vegetable, that person can't really do anything in terms of they can't move. But that, you know, someone who has higher brain death, i.e. part of their cerebral cortex, which is responsible for consciousness, memory, personality and perception, when that function is lost, then a patient can be classified as dead in some situations. Yeah, so I think, Sidan, I don't know if you want to explain the difference between...
So I just did a quick Google search, and Wikipedia said, and Wikipedia must be true. Wikipedia says that they're actually different states. So vegetative state is a chronic or long-term condition. This is different from a coma. A coma is a state that lacks both awareness and wakefulness. Patients in a vegetative state may have awoken from a coma, but still have not regained awareness.
Right, and yeah, as we said, for higher brain death, that's essentially what it is. If you have lost your awareness and sense of perception, then you can be classified as being in a vegetative state, and therefore in some situations you can actually be classified as being dead. But yes, in the UK, as we said before, you'd have to have complete loss of function of the entire brain. So someone said, wait, can I ask what is considered awareness? Right, so it's tricky because no one really knows. Obviously, if you are dead, or if someone is dead, we don't know if they are aware or not, which is a bit scary, to be honest. But that's why there are so many definitions of death, and this is why we're covering it, because for someone to have their organs transplanted, they need to be considered dead, i.e. that there shouldn't be a possibility of them being able to regain consciousness. But yes, so we don't know. And we can, however, for example, if someone is on a life support machine, we can control death, essentially. We can ensure that a person is dead. But we cannot, otherwise it's tricky to know unless we know that certain parts of the brain have completely lost their, we can detect brain waves and stuff like that, and we can see whether they've lost their function. Yeah, so Sidan, I don't know if we'll move on to the next case study now, so perhaps you could go through this. So,
should organs be taken from the living? And this is again a case study to sort of highlight this. So Ray, aged 88, is on life support after having suffered from a severe heart attack. She's a widow and has one daughter, Leah. Ray has a chronic illness, which means she was predicted to die within the next 3 years. Ray had expressed that she's very keen to donate her organs after her death. You cannot detect any pulse and know that the blood supply to Ray's brain is minimal. If her pulse is...
Sorry, I'll just get that. Yeah.
If her pulse, sorry, I've lost where I was. If her pulse does not become stable again within the next 5 minutes, Ray could suffer from irreversible damage to her cerebral cortex and brainstem, brain death. This means that by UK law, she would be declared dead, like we discussed earlier. The chance of Ray's heart rate becoming stable again in the next 30 minutes is around 4%. However, after this period of time, her heart will no longer be eligible for transplant. If you turn off Ray's life support now, her heart, liver, and kidneys will be suitable for immediate transplant, potentially saving the lives of 2 other patients. However, it is possible that if her brain remains active, she may be able to feel some pain during the removal of her organs. One of these patients, Poe, is 16 and has 2 brothers, Luke and Han. He is in a serious critical condition and has a 1% chance of survival without an immediate transplant. The other patient, Finn, is 22 and is married with a 3-year-old son, Kylo. He is expected to live another 5 years without a transplant and another 30 with a transplant. So, in this case, what would you guys do? Let's put your answers in the chat or unmute yourself and feel free to ask questions or tell us what you would think. Would you give the transplant, who to, etc.? And try and think of the 4 pillars of medical ethics: beneficence, non-maleficence, justice, and autonomy, as you're thinking about it. So again, take some time to read the case study. It's quite long, I understand.
Yeah, there are a lot of facts to consider here. And so in this case, we're not thinking about who deserves the organs, but we're more talking about, we're talking about whether it's right to take Ray off life support in order to give other people organs. So do you think that's right? And do you think that's ethical? Do you think do you think it goes against a doctor's duty to do that?
So I wonder if this points also towards the importance of getting consent in terms of, say, obtaining like a do not resuscitate form, just in the sense that if she has a very low chance of being revived, would she even want to be revived? That's, I guess, maybe the starting point. It points towards that, perhaps.
Yeah, I think that's definitely a point to consider. Of course, we don't know that based on this extract. We do know that Ray is keen to donate her organs, but you're right, we don't know whether she has requested that she doesn't want to be resuscitated due to perhaps the risk of brain damage. But that should definitely be something that the doctor would have to consider in this case. So Sedan, I don't know if you want to perhaps go through some of these answers.
Yeah, so I'm just reading some people's answers now. So one person said, even though the chance of Ray's heart stabilizing or restabilizing is only 4%, there is still a shot at saving her life. By purposely reducing this chance from 4% to 0%, you would be committing maleficence, in my opinion. Another person said, ultimately, it's autonomy. Even if though it would be beneficial to give up on Ray and save to other people, we cannot take away her chances. She may still come back alive. Then someone says, we have to respect patient autonomy and that Ray wanted to donate that organ. However, I think it would be very important to speak with the daughter. The thing with the daughter is, we talked about consent in I think last session. And in consent, you have to consider power of attorney. If the daughter does not have power of attorney, she does not have a say. Because, the person who could be giving away the heart is above 18, so they're able to make their own decisions. They don't have forgotten the name of it, but basically the decision you make, the legally binding will, the legally binding decision, the future decision that someone else could make the decision for them. How do you give someone power of attorney? So that would be done with a lawyer. A lawyer would teach you how to do that. You'd basically legally assign someone else to make decisions on your behalf.
Sorry, I think you cut out a little bit. Oh no, it might be my connection. Don't worry. Sorry, please carry on. Yeah.
Yeah, so they, and then you would legally assign them authority to make decisions, which is power of attorney, and then this person could make medical decisions on your behalf. I promise I will find the name of that the special decision where people can anticipate if they think their mental capacity might decline in the future, according to the Mental Health Act of 2005. Yeah, we did it last time. Thank you. And so they make, I think it's an LPA, if I'm not wrong, where they make a decision that in the future I won't be able to make a decision properly, or I don't think I will. So I want someone else to make a decision. Sorry, I'll make a decision now, and then that's legally binding, and then you listen to the decision later, even if I say no. So again, you have to consider that living will. That's the one. Thank you. But yeah, Shivas.
Yeah. So, right. So we've got some points here that I don't know if you would have come up with them. So I'll just read them out and hopefully you can think about whether you agree with these or not. So some arguments for turning off the life support. You could argue that the chance of her recovering is very low. I think someone mentioned that earlier. And therefore it might not be worth, attempting to just leave her on life support. It might be worth just allowing her to die. Although someone did say earlier, even though the chance of Ray's heart stabilizing is only 4%, this is still a shot at saving her. So by purposely reducing this chance from 4% to 0%, you'll be committing maleficence. So yeah, that's true. You could argue that if you do, even though the chance is low, it's not 0, and there's still a chance of saving her. So if you just completely get rid of that chance, then perhaps you could argue that as a doctor, you are going against your duties to try and help your patient. And this also links to futility, which we looked at a few weeks ago, I think, which is to do with, I think this is quantitative futility in the sense that the chance of success is so low that it might not be worth for the doctor actually to go ahead with the procedure, and it might be worth using those resources elsewhere. So another point is that even if she does recover, she's old and only predicted to live for another 3 more years. Yes, due to her chronic illness. So that might be a point to consider as well. Whereas we know that both of the patients who could potentially be saved are much younger. So they have their whole lives ahead of them. Some of them, they have large families compared to Ray, who just has a daughter. So also, I think this is one of the points that we talked about earlier. Ray could suffer from brain damage if she lives, leading to a bad quality of life, non-maleficence. And this also links to qualitative futility as well. So if she does, even if you do attempt to save her, if her pulse does become stable, but not in the next 5 minutes, perhaps it takes 20 minutes. It's, there's a low chance, but still possible. But the damage to her brain could be so severe that she wouldn't be able to talk, she wouldn't be able to move, she would just perhaps, it would be a terrible quality of life for her. So perhaps you could argue that, it might be better just to allow her to die and let 2 people live rather than condemning her to a life of constant pain and misery, perhaps. And also you'd consider the effect on her daughter as well. That would be quite emotionally distressing to live with a mother like that. And of course, as we mentioned before, Poe and Finn are quite young and have futures and families, and you could save 2 lives as opposed to 1, which is, the age-old ethical question: should we kill 1 person to save 2? But it depends what you think. And also, it does link to justice. Perhaps you could argue that killing 1 person and saving 2 lives overall is better ethically. And we know that Ray wants to donate her organs, which you could link to autonomy as well. You could argue that's her choice. But then again, saying that I want to donate my organs doesn't mean, I want you to kill me so that I can donate my organs. It's still a doctor's duty to, keep her alive. Which brings us on to the next point, which is to do with, why we should keep Ray on life support. And this is to do with justice as well. Ray's organs are still hers for as long as she has them. No one else deserves them. They're hers, and therefore doing good for the patient, for your patient who is Ray, is to let her keep them and not give them to anyone else until you can do all you can to save her. So someone's asked, do we know Ray's mental state? The question doesn't give it, so I'm afraid we don't. Although, since due to her age, you could, there is a probability, there's a possibility of her dementia, obtaining some kind of mental illness like dementia, for example, whereas that will be much less likely for Poe and Finn. So, but we do know that she has a chronic condition, I believe. Yeah. So, someone said, we don't know how long ago she agreed to give her organs. That's true, although I don't know if that would be such a strong point to make, considering that, we don't know that. We don't know. Perhaps the text says that she was very willing to donate her organs. So even if she made that decision when she was a child, or when she was much younger, we'd assume that that's still what she wants. And yes, so we also know that, so you've said, what I mean is that she could be capable mentally, still have her mental capacity. Yes, so she could be stable mentally, in which case that her decision would still, stand. Right, so for killing 1 for 2, I could argue that the risks of transplant that is brought by committing to a transplant, this may risk the loss of both Ray and her organs, losing all 3 of the patients. Right, okay. So I think you're arguing, that's an interesting point. So you're saying that there is a risk of losing people, losing all of them, in fact, but that's just a risk that you have to accept when you're undergoing this. We don't know the risks, and therefore it's not right to speculate on them, perhaps. So those are some of the points that we have to consider. I think we've had a good discussion surrounding it. So we're going to move on now and talk about how we can actually solve this issue. So the issue here is obviously that there is a shortage of organs, and that, we said at the beginning, even though there are a certain number of people who donate their organs, there are still 4,648 people waiting in the UK. And many of these, in fact, the majority of these people will not receive their transplant, and they may very well die. And this is due to, even though there are 500,000 deaths in the UK every year, there are just so few people who die in the circumstances which allow them to donate their organs. If the organs might not be the right size, the right condition, that means that many of those people will just not be able to receive a transplant. And there is a widening gap between the number of people on the waiting list and the number of people on the donor register. And we can solve this shortage in two ways. This is sort of, an economics point. We can increase the supply of the organs or decrease the demand for organs. And so one of the ways which is quite interesting about increasing supply, which has been quite topical in the news lately in the last few decades and recent years, which is people who live in poorer countries, for example, in India, Pakistan, and parts of rural China as well, who attempt to sell their organs to citizens in developed countries like the UK and the US for as little as £1,500. Because they live in such poor conditions, selling organs is the only way really they can receive money. And as you might expect, this is illegal. And it can be punished by 3 years in jail, but it's very cheap and the process is very, very fast, surprisingly fast. And many Westerners see it, or many people living in developed countries see it as an easy escape from the NHS's long waiting times. So, yeah. And, people have also, scientists have warned that receiving these organs from, unknown conditions from these countries, has a risk of being infected with disease like HIV, because these organs haven't been checked. They haven't been gone through the strict measures we have in the UK to stop these diseases from happening. And despite this, this issue, allowing unregulated organs in the UK, would simultaneously help solve poverty in these lower income countries, but also increase the supply of organs in the UK. So we're going to discuss now, should we allow unregulated organs to be transplanted in the UK, given these two benefits, the abilities to solve this shortage, but also help people living in poverty in other countries. But before we discuss that, I've noticed someone in the chat said, I think there's a lot of research into stem cells that could be used to replace damaged cells in an organ. Yeah, that's very true. And there are many different possibilities and many different new innovations that scientists are exploring to try and, fix this issue without, with as few ethical issues as possible. Although, there are also many ethical issues surrounding stem cell research regarding, embryos, which we will definitely talk about in future sessions. So now I wonder if you have any thoughts, you can put them into the chat regarding unregulated organs. Do you think they should be allowed into the UK, given, the benefits of them, or do you think that the costs of allowing these outweighs the benefits? And of course, if you want to unmute yourself and speak out loud, please go ahead and do that. Sidan, I don't know if you want to just share your opinion quickly on this and what you think about this, just to get the ball rolling.
I mean, it's quite a difficult topic because I personally believe that, again, so this is just an opinion and it doesn't hold any fruit or weight. But my opinion is that obviously it's an exploitation of people that are trying to, people in poverty, because if people to escape poverty are trying to sell away their organs, they could be in really bad health, because if they lose an organ or if a surgery goes wrong or a removal goes wrong, where a really necessary body part is removed, maybe accidentally or harmed, it's very dangerous, and that person could actually die. And I don't think that death is a viable alternative to escaping poverty for a tiny amount of time, because it's not a constant source of income. It's a temporary fix, and it's illegal for this reason. Not only this, but the fact is that it could be really bad if they've donated their organ, they've put their life at risk, possibly their family at risk. If this person could pass away because of this, And then because, again, like you said, India, and then again, India is just over 4,000 miles away from the UK, which means that we somehow have to allow the organs to not rot in that journey, which would be very, very difficult, because there'd be a lot of logistical barriers that the person would have to cross to try and get the organs in. So I'm completely against allowing unregulated organs to be transplanted. But again, as you say that, you know, it's a very difficult thing to discuss, because, you know, there are so many different variables to discuss. But that's my 2 cents on the issue.
Mm-hmm. Yeah. So we've got quite a few answers in the chat. Someone said it feels very exploitive of these people living in poverty beneath the guise of helping people in poverty. Because of economics, the moment you have people supplying these organs for money, someone could lower the prices, and these people will be exploited for these organs and won't have enough money to come out of poverty. Yeah, that's very true. And there are lots of things you can consider here. Like Sudan said, you know, even if you do help these people in poverty, you know, it might only be a temporary fix. And in the long term, you know, the health issues that can result from losing an organ, especially if there's an organ, you know, like the liver, for example, people cannot survive without a liver. And it's, or you know, so it's very tricky. It could have such long-term health issues for these people that it might not be worth it. So someone else has said, I have heard of research into man-made organs, especially of the heart. Yes, and there are mechanical hearts that are now being, you know, transplanted in the UK as well. So there are, and you know, someone mentioned stem cells as well earlier. There are many different options here, and perhaps these ones could be better than allowing these unregulated organs into the UK. So someone said it's dangerous and it could be abused. Yeah, people are attacked in airports. Yeah, it's true. Although the aim, you know, these people are so desperate to get money that, you know, they would go to these lengths to do that. So, yeah, if you did allow unregulated organs, who would be liable if something went wrong? Yeah, that's true. Obviously, this is illegal. So the NHS isn't involved in this trade of organs, and neither is the UK government. So if something went wrong, there's nothing you can do. If you go to a hospital saying, you know, I received an organ that, you know, has, you know, I've sold my organ or something, and now I'm experiencing, you know, difficulty, you know, my, for example, if you sell a kidney and now you're experiencing kidney failure or something because you only have one, you know, it will be difficult to treat you because the NHS, it doesn't have a record of what what medication you've taken and how the treatment was carried out. Yeah, so someone said taking organs from people in poor countries feels like slavery all over again, organ farms basically. Yes, so it is really exploiting these people, and it is really only a temporary fix. Promoting organ donation for monetary benefits can cause a large number of people to start donating their organs, which can boom an already black market, which adds issues regarding regulation of highly sensitive logistics. Yes, of course. And we do, you know, allowing this to happen would mean, you know, more and more people would start doing it. And you know, that makes it very difficult to transport these organs. The conditions could become even worse for their transport. You can lose both the donor and the recipient, even if one thing goes wrong. Yeah, that's very true. So it might not really solve the issue, really. So yeah, it's tricky. So we've come up with a range of ideas for this topic, and I think the overall consensus is definitely that we shouldn't allow unregulated organs to be transplanted, even though they could solve the shortage of organs here. But I think mainly the reason people are saying that is because of safety. Right. Oh, someone said, if there are 500,000 deaths, why do we only have 6K potential donors? Why can't we use more? Yeah, like I said before, most of these people who die in the UK are not dying in conditions which allow their organs to be transplanted. You know, for example, people who die from old age, their organs might not be suitable for transplant. I think the majority of people whose organs are donated have been involved in, yeah, like someone said, car crashes. They're involved in severe, traumatic situations like car crashes or injuries, which are very severe, which means they've died very suddenly. And that's really the only case where we can take organs from these people. So yeah, it's tricky, and of course, people need to be, if someone in one part of the country needs a specific organ from a specific tissue type or blood type or something like that, and someone on the other side of the country has got that organ, it can be difficult to transport it. There are many logistical issues surrounding it, and the system is they're attempting to make the system easier and making it easier for people to provide their organs after death so that it can be done immediately, but it's very tricky. Right, so yes, someone has said organs, unlike blood, is highly specialized, which is the biggest reason to turn down the number of ideas to promote organ donation. Yes, so organs, like we said before, the success rate of transplanting organs generally have the highest success rates, but of course that's not always possible. So we've raised a lot of good issues there. So we're going to move on now and talk about an interview question. So Sinan, I don't know if you want to introduce this for us.
Yeah, so should the UK have an opt-in or opt-out organ donation system? So as we discussed, the UK now, as of May 2020, has an opt-out system. And as it says, in an opt-out system, all patients over the age of 18 are presumed to consent to having their organs donated after they are declared dead, which basically means that at the age of 18, because you're an adult, the government therefore believes you to be fit and happy to give away your organs unless you opt out by yourself later on. So if you don't, and your organs are perfectly able to be transplanted into someone else, then the government will go ahead and do that. Then the medical system will go ahead and do that. That's how that works. And the opt-in system is that if basically all people in the population in that country where the opt-in system is in place, in that country, it's just assumed that no one wants that to happen. And so the only way that the organ donation will happen of that person's organs is that if that person steps forward and opts in legally that, yes, when I pass away, if my organs are viable for transplantation, I would like them to be transplanted. So those are the two things. And again, there's a huge variety of debate, because what if someone doesn't know that there's an opt-out system but doesn't wish to have their organs transplanted after they pass away? There may be religious concerns, there may be ethical concerns, there may be personal concerns. And again, you guys can think about if the UK should have an opt-in or an opt-out system. So I'm just going to answer a few questions.
Okay.
Is this the first time the UK has shifted to the opt-out system? That's a very, very good question. I'm not sure. I'll just Google that quickly.
I don't think they have had an opt-out system before. I think it's just because organ donation is a relatively new thing. And I think from the beginning it was just, you could register your interest to opt into organ donation. But now, considering the importance of it and the shortage of organs, I think now more and more countries have decided to switch to an opt-out system. It should be the default to donate organs rather than the other way around. So then I don't know if you've found any.
It's so www.organdonation.nhs.uk says the ability to register an opt-out decision has been available to all UK residents since July 2015 in preparation for the Welsh law change in December 2015. However, I'm pretty sure they only changed to the opt-out system in 2020, so I'm not completely
sure. I know because I think Wales actually did it in 2015, so being the first country in the UK to do that, and then I think so England was followed in 2020. I don't know about the other countries of the UK, but I know Wales was the first, I believe. I'm not sure I think someone unmuted themselves. I don't know if you wanted to add a point. Maybe not. Okay, don't worry. But we'll start with the, with the trying to answer this interview question now. So looking at both sides of it. So we're going to look at, firstly, we should have an opt-in system, which is arguably the hardest the harder one to argue. So perhaps you could put your answers in the chat now, what you think the benefits of having an opt-in system is, and whether we should do that as opposed to having an opt-out system. So I think this, like I said, this is the harder one to argue. So someone said immediately, more respectful of people's wishes. So, people may not, okay, so it's tricky to argue that, because you could, just as easily say that if we have an opt-out system, it's still respectful of their wishes, because they could, change their opinion. They could change what they've said to, not donate their organs, and therefore, if you're talking about it from a point of view regarding autonomy, nothing has really been changed. So someone said, oh yeah, sorry.
Sorry, can I speak? Sorry.
Yeah, of course.
So I was gonna argue for having an opt-in system, like in an opt-out system like we have now. I'm pretty sure that even if you don't opt out, but you die, can't your family members still disagree with you, like donating your organ after you die? So I was gonna say that even if you choose to, no, even if you don't opt out, your family members can opt out for you. So I think that kind of goes against the point of like it being more respectful of the patient's autonomy by like choosing to opt out, if you get me.
Yes, sorry, I was just going to say something about that. So I just pulled up a document, and I think I sent it to someone in the chat, but that document basically says that the family, if the person has signed the organ donation card and said that they wish their organs to be donated, the family can't do anything about that, because it goes against the consent of the original patient, and that the family cannot intervene.
Okay, my bad. I thought that the family could intervene.
I did too, actually, and that's why I Googled it really quickly.
I think the family can't change the opinion, like can't change what the person has said regarding whether they want to donate their organs or not. But they do, if a person's, I think the family can have a say, and they can express their opinion on behalf of the family member. So, if a person didn't change their mind, if they hadn't registered an interest whether they wanted to donate their organs or not, then the family would be able to, if they knew what the patient wanted. But it's tricky. I don't know the exact rules regarding that.
Yes. So sorry, Shabazz, just 1 second. Yeah. I'll send the document in the chat. It says it's by the AOMRC. Their website is www.aomrc.org.uk, and they said that if someone, if the original patient has said that they refuse to donate their organs, but then the family says that if they refuse to donate their organs, the family can't overrule this. However, if the family provided new evidence about donation, it's unclear what it means by that, but if the family provided persuasive evidence of consent to donation which was more recent, so basically if the family provided evidence that the patient had actually consented after not consenting beforehand, then it would be considered. But again, you have to realize that this is not the family overruling them, this is the family providing evidence for the actual consent done by the original patient. Alternatively, if the person has not given, if the person has given consent, and then the patient hasn't, if the patient has given consent and the family doesn't want that, they can't do anything about that. I'll send the document in the chat, and I think it's a good thing to have a read through.
Yeah. So I think so. Going back to what we were talking about, the benefits of having an opt-in system. I've just read your comment. Someone has said the change wasn't very noticeable. So you're arguing that it should be very important that people are very clear on how the system works, and otherwise they're just taking advantage and exploiting people's lack of knowledge and their ignorance. So I think that's a very good point. So you're saying that perhaps we should have an opt-out system, but we should make it very clear to people what that means and, how that affects their decisions. Because, if people don't know about this and they don't want to have their organs donated, then, that would mean that their organs are donated, without their knowledge of it happening, which perhaps goes against autonomy. So I think, yeah, that's a very good point. It's important that people know what's going on and they're able to make their decisions because they have a strong basis of knowledge regarding the situation. So, right, someone said, only people who really want to donate their organs will opt in. Okay, so you could say that it respects patients' autonomy that way because, you know, it's a choice that people, you know, should make. It's quite a big choice, and therefore only the people who want to do that will do it. But then again, you could argue that the opposite way around for opt-out. People have said reduces ethical concerns, giving people more responsibility for their own life. Yes, I think that's a very good point. And I noticed, and some people have said in the past, one of the main criticisms of the opt-in system, was that people, you know, well, I think that more relates to opt-out actually. You know, people have more responsibility of their life if they if there's an opt-in system as opposed to an opt-out system. Someone said moreover, some people may not have the facilities to opt out. Yes, so I don't know if it does happen over the internet. I think perhaps you're right. I think it does. So it's discriminatory to assume everyone can do that. Yeah, and that links to what we talked about before about, you know, some people not knowing about this. So if perhaps someone is quite old and they don't know about this new change and they perhaps don't use the internet, they don't have a computer, then they, you know, they may not be able to they may not be able to express their decision, which perhaps goes against patients' autonomy. Right, so I think we're nearly done now and we're going to finish up soon. So we're just going to go through the points for both sides and then we'll finish. But yes, like people have said, autonomy is really the main issue for opt-in. People are assumed or presumed to make a decision when this may not be their wish, which is presumed consent. And of course, like we said, people who are unable to change their preference due to disability or age or lack of access to a computer may have their autonomy restricted. And of course, there are religious reasons, and, you know, if organs are removed without the express wish of the deceased, it could be distressing for the family when they, you know, they might not have peace of mind because the patient may not have, you know, expressed their opinion, and so the family may be distressed due to that. And another one, which is quite interesting, is that it can be interpreted as an unlawful invasion of people's rights to control their own body. So, you know, people could say that if we have an opt-in system, then it means that perhaps it's not respecting people's rights to, if we have an opt-out system, it might not be respecting rights to control their body because things are just taken from them. You know, their organs are taken without their consent, and perhaps you could argue that it means that the state or the country or the government controls someone's body, which is quite an interesting point. And again, I don't think anyone's mentioned this, but doctors may be less willing to save a patient or perform a potentially futile treatment if their organs are going to be donated. And this has actually been the case. So doctors might actually, like, it's similar to the case study we mentioned before. You know, if someone is on life support and they have consented to having their organs donated, then a doctor may be less willing to actually try and save them because their organs could be given to someone else, and therefore it might be, you know, help other people and save their lives instead. So in terms of having an opt-out system, obviously it would be very beneficial in terms of helping reduce the shortage of organs. You know, with Belgium, they when they introduced this system, donation rates increased by 55%. And I know now that it's been introduced in the UK, it's also been increased a lot as well. And it could reduce the number of illegally obtained organs, as we talked about before. So it could, you know, we discussed, and I think we came to the consensus that getting unregulated organs is unethical and it shouldn't really happen. And having this system would reduce the need for people to, you know, obtain organs illegally. And it respects a patient's autonomy. The choice is still available to them, although you could argue that their autonomy is still being restricted. But it doesn't mean that patients have not been given the choice. The choice is still there for them. And also it reduces the pressure on relatives to consent when they're grieving. Instead of doctors having to ask relatives, should we give their organs away straight after a patient has died, when families may be distressed and they may not want to do that, the choice has already been made, so they might not have to make that decision. So I think we're going to finish up now, and these are just some of the points we've talked about today and that we've discussed today. Should we adopt, these are some of the ways that we can reduce the shortage of organs. And in terms of other ways we can do that, I know someone mentioned stem cells and someone mentioned mechanical hearts as well. And so there are many new methods being explored in terms of how we can solve this issue. But I think the opt-out system was one of the main ways and one of the most significant, and it's had one of the most significant impacts on reducing the shortage of organs. But with new advances in technology, more and more ways are becoming available. So yeah, I think that finishes today's webinar. I know we overran a little, but I hope you've enjoyed it. If anyone has any more questions, then please do ask them. But apart from that, I think we've finished. So yes, please do contact us on our Instagram or our email address here if you have any questions for us, or you want to ask us any questions. If you want to ask us anything about what we discussed today. But yeah, apart from that, I think we're finished.
Thank you guys so much for coming. I really love this topic, and I hope you guys learned a lot about it as well. And yeah, look out for our future events. And as always, please feel free to share these events with other people and ask them to join as well. Like, we love to tell more people about the things we're interested in. Just as a final note, I'd like to say, I as in organ transplantation and just transplantation and consent in general, I would recommend you look up the Henrietta Lacks case. We talked about this in a previous session, but it's very interesting. Yeah, so thank you very much for coming, guys. As always, we will put information on Instagram about future events as well as sending out emails. But thank you and bye.